everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Betamethasone Valerate. Its brand name is Valisone. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Betamethasone Valerate is a topical corticosteroid that possesses anti-inflammatory, antipyretic or anti-itch, as well as vasoconstrictive properties. Corticosteroids may induce proteins that inhibit phospholipase A2. This may interfere with arachidonic acid, which is a common precursor to different inflammatory mediators such as leukotrienes and prostaglandins. In terms of indications for use, Betamethasone Valerate is indicated to be used in the treatment of dermatosis of the scalp, and it can also be used to treat disorders of the skin that have inflammatory and pruritic manifestations. Now, before somebody was to use Betamethasone Valerate, there is a contraindication that they must clear, which in this case would just be a hypersensitivity to Betamethasone Valerate, other corticosteroids, or any other component of the product, and there's also some precautions and warnings that they should be made aware of. It should be noted that pediatric patients may have an increased risk of experiencing systemic toxicity while using Betamethasone Valerate. This is due to the higher skin surface area to body ratio in these individuals. For this reason, a dose adjustment may be necessary if the medication is to be used on a pediatric patient. Failure to heal after using this medication may be a sign of allergic contact dermatitis, and the medication should be discontinued. And lastly, patients should be made aware that Cushing'S syndrome may occur with the use of Betamethasone Valerate. Now, once somebody is cleared of the contraindication, made aware of the precautions and warnings, and they start to use Betamethasone Valerate, they can expect to receive their dose through a lotion, a foam, a cream, or an ointment. If somebody is using this medication to treat dermatosis of the scalp, they would typically use the 0.12% foam and apply this to the scalp twice daily. The physician would typically reassess the diagnosis if there is no improvement after 2 weeks. For disorders of the skin that have inflammatory or pruritic manifestations, a patient may try using the 0.1% cream or ointment applied 1 to 3 times daily. They would be instructed to apply a thin film of the medication and keep it localized to where the skin is irritated. You may also try the 0.1% lotion and apply a few drops to the affected area about twice daily. In some stubborn cases of skin disorder, they may have to increase the dose and use it for a prolonged period of time. Now, in terms of side effects with Betamethasone Valerate, some patients may experience a burning sensation, some may experience itching, and others may experience stinging of the skin. Now, some more rare but serious side effects would be Cushing'S syndrome that we mentioned earlier in the video, as well as hyperglycemia. That's all we're going to talk about with Betamethasone Valerate, or Valisone. As always, I'm very thankful you took the time to come by and watch one of my videos. If you thought the information was valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.